Swayam Prabha. Digital India. Educated India.
Welcome viewers, welcome back to this course on ESD, ESD for Sustainable Health Care. So, continue with that healthcare facilities and sustainable health. Now, we will proceed for further things like this is the healthcare infrastructure model in India as we are focusing primarily on enhancing the health services in India primarily. Keeping in mind the global health status also. So, the healthcare infrastructure in India, how it appears, that is the main domain is that public health sector is there, even private health sector is there, and indigenous system, that is our traditional medicines like the Ayurveda, then Unani medicine, then Siddha and homeopathy, all these are, it comes under our indigenous system of medicine. Then some voluntary health organizations, social agencies, then NGOs and social entrepreneurs also they work in this. So, primarily the responsibility lies in the public healthcare system, that is with all kinds of this specialized hospital healthcare centers. Then here you can say health, then these are some of the training center, education and training center for the health service and thing employees, for the employers infrastructure, then the central government, all kinds of the schemes and the ministry etc., and other agencies which are allied with the health sector, then defense services and the railways etc., etc. So, railway hospital, defense hospitals, these are there. So, parallel, that means parallel health agencies running simultaneously in other domains. Then private health sector is primarily, it is a kind of private hospitals, specialized nursing homes, hospitals etc., private, private, but these are also working in along with in cooperation with the public sector health services. Then also we take the help of, we can say on our individual capacity or being the member of different societies, take the help of these kind of benefits, the Ayurvedic medicines and then homeopathy medicine etc., and the other voluntary organizations which are also not exactly on the treatment, but also they are also working on this diagnosis, a kind of referral services and the consultancy services. So, this is the framework of healthcare structure in India. However, there are some problems of the, what are the key problems, the crucial problems of healthcare infrastructure in India, that is first thing is the shortage of staff and equipment. So, in most of the public health hospitals, public health organizations, the primary health care centers, lack of modern or latest equipments, a lot of updated equipments, lack of updated equipments and infrastructure. So, that is one of the crucial issues, and moreover shortage of staff, such as shortage of trained staff who can actually operate, who can handle and who can actually counsel and direct the people, or even provide the support system, support services to the existing physical practitioners. So, the shortage of staff, especially the nursing staff, especially the caretakers, especially the supporting staff, and shortage of updated or the latest equipments, especially in the rural and remote areas. That is one of the problem that we are facing in India. Then healthcare infrastructure is heavily skewed in favor of urban areas, because in urban areas, most of the urban cities and cosmopolitan cities, we are having the very good hospitals from the from Apollo, from Amri, from even nowadays all AIMS are there in every state capital, almost every states. So, all these good hospitals and with good infrastructure and health services are primarily situated in the city areas, urban areas. So, that is the disadvantage, because the remote people, they cannot, rural people, they cannot have direct access to this kind of quality service. So, they have to come down to this kind city hospitals and city areas, urban areas for any kind of treatment. So, then again interstate and intrastate variations, again within every state, like again moreover this all the public as well as the private hospitals are functioning in the urban cities. So, within the state, some of their some of the state policies, state health department initiatives, schemes, etc. So, these there are different variations in interstate between two states, maybe that something is very good in Maharashtra or Gujarat, maybe in comparison to that the other things are not so good in other states, like maybe in MP or some MP or northeast, etc. So, interstate variations are there, and intrastate within the state also variations are there. Intrastate support within Odisha, within West Bengal, like some zone wise, maybe that central zone is very much facilities are available, like the state capitals are very much enriched with this kind of facilities, whereas the remote areas within the state are not deficient in some of the infrastructure and facilities, etc. So, now that is why all these, now that is government has adopted a scheme, a rule for deputing the doctors, the freshers, the fresh MBBS doctors, to depute them to the initially to the rural sector, to the rural people, to the remote posting first. So, they want to settle down, they will be, it is a mandatory kind of thing that they will be shifted, they will be transferred to initial first posting will be definitely for 2 or 3 years in the remote area, primary health care centers in the rural and disadvantaged community. Thereafter, then you can move on to the semi-urban or the urban cities. So, no proper regulatory mechanism and monitoring, especially for main hospitals or the urban hospitals. So, with the digital platform and facilities, monitoring and evaluation mechanism there, feedback is there, appraisal form is there. It is functioning a little bit better in comparison to remote areas. The remote areas are practically there is no monitoring, no evaluation, no appraisal mechanism, etc. Whereas in the urban areas, these things are better, but we cannot say that it is the best, because one or other way some or other good hospital also, they are also lacking in some or other way. So, it has to be harmonious and consensus development, like that means thing is that you cannot be very much complacent in the sense that yes, our hospital is the best hospital, we are having the best service. You cannot be, any hospital authorities, they should not be very much complacent that we are the best, they cannot take the pride of, because always we should be in a form of continuous learning. So, even though we are better, even though we are providing the best service, how can we be much better than this? How can we be the best? So, gradually, that means we have to be passionate about better service, better quality, getting the data feedback, and being transparent, and even the not only the quantitative data, that is this much of operation, these things, etc., but the qualitative feedback to enhance the service, better service infrastructure. Even though the hospitals, if they are having, in spite of having the better infrastructure, OT, doctors, so and so, but the communication, but the caregiving service, the communication, the liaisoning thing, the logistic thing, and this patient care, especially the patient care and care for the, and being empathetic and proper communication to the patients, caretakers, these things are also very, very crucial. These are it appears to be very minor things, but these things actually because it is a service related industry, service related organization sector. Hence, these kind of qualitative relationship, human relationship, empathetic relationship also matters a lot in enhancing the value, or the significance of your health services. So, these have to be introduced, the regulatory mechanism, monitoring and regulatory mechanism, and appraisal and quick feedback and appraisal, time to time feedback, these are things are very important. So, a research study done by the Garg et al. 2020 said that the public healthcare system is grossly inadequate to take care of the health needs of the citizens in the post pandemic. So, during the pandemic also, all of us we have experienced that how chaotic the situation was with the lockdown, with the police staff, police staff and the medical staff being overburdened with the workloads, and with limited unless and until the vaccine has come up, and with the emergency of so many so many outbreak of so many COVID cases, etc. Then an installation of the COVID hospitals and proper training to the doctors and nurses regarding the COVID treatment, COVID patient treatment. All these, it creates a complete chaos, not only in India but across the globe. So here, so these are the, we can say these are the health related health system building blocks. So WHO has identified these 6 health system building blocks that from the study, that the lessons are learnt, and during this pandemic, what actually pandemic has taught us regarding these lessons. So first thing is that the governance and leadership should be very meticulous in the done is from the, definitely at this point of time, this centralized governance and leadership qualities is very important. The leaders should be extra cautious, extra caring, extra strategist, extra proactive in their thinking, in their strategic thinking and implications and reflective ideas. So then that is one thing, that leadership and governance is most important. Second is a health information system, that is all our digital helplines, that is second most, that is data entry, data dissemination, then updating the system, all kinds of health information. So that health information system, that is the digital platform, should be very robust in that sense. That has to be, that is another important factor. Then service delivery, quick service delivery, because even though we are using it in the digital platform with the latest technology and so, but ultimately human resource also matters a lot, because the mediators, the mediating mechanism is being done by the human resource. So service delivery, machines can be updated, machines can be operated through robots and AI related machines, etc. But however, the services can be also provided with the better human services with human empathy, value and the concern. Then finance is definitely, economy is a financing, and the cost is a very huge factor. And with this pandemic, with the lockdown, the governments, governments funds and the fund for the all, as per establishing all this COVID hospital, updating the facilities, etc. It remains challenge. It has remained a very challenging task for the government especially. Then the health workforce, and instantly, abruptly and on emergent basis, how to create a large health workforce with the shortest period, within the shortest minimum time limit, with the proper training of the health workforce. That is also another primary challenge. That means this is the time that we actually realize that how backdated we are in creating the health workforce and trained workforce, not only skilled and trained workforce. And then again, access to the essential medicines, again essential medicine in terms of again another chaos is also that the same medicine can be that means can be found or are being sold out from the different banners, different brands with different prices. So then again to identify the different differences and difficulties, and how to curb the prices of the medicines, like same medicine are being sold in the different prices on different companies' brand names. So how a common man can have the easy access, affordable can afford to this kind of expensive medicine from the market. So that is educating the common man, the people, regarding the medicines, updating them regarding the affordable or the less expensive medicine for the same treatment. These kind of things are also very important, because it's not for the medical business, enhancing the business of medical medical enterprises, but also capacity, but enhancing the capacity or capacity building for the people, common man, to acquire some minimum knowledge about the medicines for different illnesses, different sickness, and the compositions, how the same thing can be recovered, can be procured from other sources. This kind of medicine related information, sharing this information, this is also another challenging task, because here the affordability, the cost of the medicines cost also can increase to it can also be a burden to the common man at the rural people. So these are some of the challenges that we are facing. So this corona pandemic actually has truly taught us so many lessons, and which also helped us in rectifying our health system, in enhancing the effectiveness of our system. But still we are learning. We are not completely, that means achieved everything, but we are still learning, and we should be better prepared for the future such kind of disaster disaster health service or health factor. So, we should be better prepared for the future. So, we should not be very happy or complacent that yes, we are updated now, we are having the vaccine. We should not be complacent, we should not sit idle, but rather keep on working on the not only that not only on the services and infrastructure information system, but also the medicine cost, vaccines, and how we can indigenously, how the indigenous medicines can come up with the lowest price, so that our common man, rural people, poor people can afford to purchase it and buy it. So, these are some of the key issues. Another study that also highlighted the disparities in the rural and urban India, the health services, and how to strengthen the primary health center. This has become a primary issue, primary area of focus for our thing, and increase expenditure on health, especially in the rural sector, in the public sector, public health sector, and with the combination of the physical and the human infrastructure. Physical infrastructure is required, as well as the trained health staff, trained workforce, trained health workforce is also very important. So, we should also give focus to these kind of issues if we want to make our healthcare system more sustainable for the future. So, training and skill upgradation of the local health with the primary health centers to the care workers, for opening the medical colleges in the rural areas, proper regulation, monitoring, evaluation, feedback, counseling, proper counseling also. With every hospital there should be proper counseling center that is for to take care of their mental health issues. So, similarly, another stringent law and punishment for any such kind of unethical health practices or unethical healthcare services. Then use of technology and the telemedicines, mobile hospitals, especially in the rural areas, hilly areas, tribal areas, and with the minimum for minimizing the cost, and active involvement of the community health program, healthcare programs, and how to collaborate with other health agencies, like some agencies, NGOs, which are exclusively working on the social sectors, health service sector, skill development sector, training sector, like giving training to the nurses and the ANMs, nurses and other supporting staff. So, building the skilled workforce, trained workforce in health sector in collaboration with other NGOs or nursing centers, training centers, skill development centers. This is also a very important task or issue, a challenge for us so that we can build up a very robust healthcare system. So, participation in the Global Health Security Alliance, then National Health Security Action Plan, Ayushman Bharat scheme, and the technology through telemedicine, mobile health, digital health platforms, different health apps like you can say health apps during the pandemic, that then open data sharing policies, training, supervision, and facilitation of the healthcare delivery system. Then then manpower trained epidemiology, the different kind of workforce, they should be trained in different kind of epidemics. So, manpower trained in the different epidemiology also should be given special emphasis. Then readiness to respond, quickness, promptness to respond to this kind of pandemics and the critical health issues, that is also very, very important. So, we have to, that means so many, health is a it's a society, it's an enterprise. So, it has n number of issues, n number of branches. So, we have to be very meticulous and very careful, very empathetic, very sincere and very passionate about all and every major as well as the minor issues. So, if you want to maintain, or if you want to make our health system more sustainable for the future generation. So, we can say that here sustainability of healthcare system depends on 7 factors that we have already discussed, but to have an overview, that internal factors, we have already the internal factors, that efficiency and effectiveness of health and care provisions, availability of the well trained healthcare workers, nurses, staffs, etc., cost effectiveness, that is the internal factor. External factors is the health and resilience of the population, the community people, the workforce, etc., how resilient they are, the population. and the contribution of the caregivers and the informal networks of the care. Again, there are also the media agencies, the reporting agencies, the information sharing agencies, those who are there for the publicity, for the advocacy, for the counseling. So, their service is also is very important in case of informal network and caregiving, and giving the right information, educating the people. So, these are the things, and integration policy and the practices with the other sectors like public private partnership with NGOs and other local communities and primary healthcare centers. So, that is also, these external factors are very important, and overall as we have already discussed, that both the public and politically acceptability and support is very important. If we are going to start an health enterprise in any city or any country, any rural area, etc., it should be supported, wholeheartedly supported by the common man, the public, as well as the political people, like by the government. So, both public and political parties of the government full support is very much important for the overall efficiency and effectiveness of the hospitals, all the hospitals or the healthcare facilities and systems. So, because the healthcare service is a very valuable service, so the inherent value that lies in the healthcare, that we can find out is, that we can find out with this kind of formula, this kind of calculation, like the outcomes for the patients and the populations divided by the environmental plus social for the financial impact. That is the triple bottom line, the issues, that environmental impact, social impact, and the financial cost effectiveness impact. So, that is this kind of thing with the equation with outcome of the patients and populations. So, it can show us how valuable this healthcare facility service is there in any particular kind of location of the state or the country. So, here value is related to, as we can say, how well a healthcare system meets its objectives. Not only that the healthcare subsystem meets its objective, but it also looks into the affordability rate, its waste management, its impact on the social development and economic and the finance, even for the economic growth and finance of the community of the that means to maintain a balance in your prosperity or the economic domain, economic growth of the enterprise, as well as the affordability rate of the public. So, that is all these health policies are there, the Modi care policy, healthcare policies are there, that is to, so that with the health card and the minimum expenses, how the poor and rural people, they can get access to the good quality of health services. And so, it can be defined as the outcome of the process relative to the cost, how effective it is, outcome of the whole process in comparison to its cost and effectiveness, and how ecologically, environmentally sustainable it is in terms of protecting the ecosystem and minimum carbon footprint and minimizing the waste and proper waste management. And again, the cost that includes the environmental social impacts, so that should not exceed also. So, the outcome also it refers to both the individual patients as well, individual patient satisfaction, that means follow-up feedback is also very good. At the same time, overall outcome, that is total communities of the population's outcomes would also be very good and satisfactory. So, the sustainable value in the healthcare, so here can be expressed with this given thing. So, this is the sustainable value of healthcare, that is outcome of the patients and population divided by all the triple bottom line impacts, that is social, ecological, and the economical impacts. So, here we can talk about a kind of health grid. So, what is this health grid? So, this health grid is, can say, it is a kind of system, it is a kind of system design system, where it is comprised of the data, comprising of the data of the medical interest and medical related information, and made easily available to different actors in the healthcare system. The database, we can say, creating a database for all kinds of stakeholders, and the information regarding the physicians, doctors, healthcare facilities, available centers, and the patients and the citizens, for all kinds of database and information. That is the how to set up a health grid or the system on the consisting of all kinds of the primary data, primary information. So, similarly, health grid also focuses equally on sharing the data. It is not for the only possessing for the central government or the public sector domains, but it is for how to share the data. Data in association with other agencies, but of course, by following some privacy, some ethics and some kind of thing, from you can say from security also, security things. So, and distributed health analysis across the biomedical spectrum. So, from also from time to time the analytics would also be done to analyze different kinds of distributed health analysis across the different biomedical spectrum in different public health domains, to the patient care, to the that means organizing the data to the cellular and the genomic information, and all kinds of new emerging diseases like pandemics, like now this COVID-19, it has created enough database, enough information system for the better preparedness of the future. So, this kind of emerging challenges also, that should be also taken into account. So, this how to maintain this all kinds of data, share the information, disseminate the information, doing the analytics for better preparedness, for forecasting, for predictions, for better preparedness. These are the issues. So, that is the advantage of the developing a health grid. So, for individualized healthcare system, these health grids actually they envisage to facilitate access to biomedical information and ultimate knowledge. Now, suppose any patient he has some problems, health issues related to blood pressure or heart disease or diabetes or whatever, he can search in this grid, health grid in this system, that which hospital has the best medical service treatment for this, who is the best doctor, and what in which hospital what extra facility is there, which is affordable, which cost, everything, every data, single information they can get from this system, that health grid system. So, all kind of biomedical information on demand can also be served. So, all kind of like the Google search, like all kinds of biomedical information can be provided on demand basis also. So, and research and continuous research and development activities also continues to strengthen this field of health grid. So, this is the new pattern, a new pattern updated system, that means developing the whole health system in a very robust way, that is developing a sustainable and robust health system through establishing a health grid, that is for the harmonious development of all the healthcare services and system, as well as the dissemination of biomedical information, services, everything. So, these are some of the links that you can go through for the better sustainable healthcare and health related services. So, now I am concluding it here. So, in the next class we can continue with other topics. Thank you very much.